Universal and standard precautions in childcare. Universal precautions are a set of guidelines and protocols that are used to prevent the spread of infectious diseases in childcare settings. These precautions are based on the assumption that all bodily fluids, including blood, are potentially infectious, and as such, should be handled with care and respect. Standard precautions are a subset of universal precautions and are used to prevent the spread of infectious diseases through contact with blood and other bodily fluids. These precautions include hand hygiene, the use of personal protective equipment, PPE, and the proper disposal of sharps and other potentially infectious materials. In childcare settings, universal and standard precautions are essential for protecting the health and well-being of both children and staff. Here are a few key things to keep in mind when implementing these protocols. Hand hygiene. Regular and thorough handwashing is the single most effective way to prevent the spread of infectious diseases. Staff should wash their hands often when working with children, as well as after any contact with blood or other bodily fluids. Personal protective equipment. Staff should wear gloves and other PPE when working with children who are known to be infected with a contagious disease, or when there is a chance of contact with blood or other bodily fluids. This can include masks, goggles, and gowns, depending on the situation. Cleaning and disinfecting. Child care facilities should be regularly cleaned and disinfected to prevent the spread of infectious diseases. This includes wiping down surfaces and equipment with a disinfectant, as well as regularly laundering bedding and other linens. Proper disposal of sharps and other potentially infectious materials. Child care facilities should have a safe and effective system in place for the disposal of sharps and other potentially infectious materials. This can include sharps containers, biohazard bags, and proper training for staff on how to handle these materials. Proper isolation and quarantine protocol. Child care centers should have protocol in place for isolating children who are known to be infected with a contagious disease. This can include separating them from other children, and not allowing them to return to the center until they are no longer contagious. By following these universal and standard precautions, child care facilities can help to protect the health and well-being of both children and staff, and prevent the spread of infectious diseases. Thanks for watching. Please comment, like and subscribe.